Hello and welcome to today's episode on life-saving aids. Today we are going to be looking at burns in infants and what we can do in order to help reduce the complication and help increase their chances at survival. There are different types of burns, but for the purpose of this video, we are going to be focusing on thermal burns. These are burns that result from exposure to excessive heat. And this can be from hot water spill to hot oil spill or hot milk spill or any excessive heat exposure. Now in this baby, hot water spilled on this baby. And as the rescuer are there at the scene, what do you do in order to help reduce complication in this baby and help increase their chances at survival? First and foremost, you must remove the baby from the source of that excessive heat. So if the hot water is still pouring from wherever it is on the baby, you quickly remove the baby from that source of hot water. If it's during bedtime and then you accidentally turn on the heater and the water coming from the heater is very hot, what do? You quickly remove the baby from the source of the heat. Next, you take off the clothing from the baby. Why is this important? That can now become the temporary source of the heat. And in doing so, ensure that you don't take the part that is containing the hot water or the hot substance over the head of the baby. What you'll be doing when you do that is to spread the area that is going to be affected by the burns. When you're taking off the clothing, the goal is to limit the area that is being exposed to this excessive heat. If it's a clothing that you can easily take off with little exposure to other part of the body, you do that. And if you can't, you cut off or you tear off the shirt. You take off the clothing through the hand in order to reduce contamination to other parts of the body. That way you limit the spread of the burns to other parts of the body. The next thing you do is that you quickly move baby to a source of cool running water for 20 minutes. You quickly move the baby to a source of cool running water and place that part of the body under cool running water for 20 minutes. The reason why you are placing the baby under cool running water is to, number one, help reduce the pain. Two, help reduce swelling at that area. Number three, it also helps reduce the damage to the skin and other cells around that area. Now, if you're in an environment where you don't have access to cool running water, what do? You get a clean cloth, maybe a clean towel, you soak it in cool water and place over the area of the burns, something like this, and leave for 20 minutes. The reason is, like we said earlier, it will help reduce the pain, it will help reduce swelling, and it will help reduce damage to that part of the body. The part of the body affected by the burns is now a sterile wound. What that means is that there is no infection or organism around here. So what do? You quickly cover that part of the body. You get a sterile gauze or a clean plastic bag or nylon and wrap around the area that have suffered the burns. And with a clean nylon or plastic bag, you wrap around the injury sites. When you've done that, the next thing you do, you wrap baby with a clean blanket. The reason is because in burns, one of the complications babies can run into is hypothermia. Is a condition in which their body temperature drops significantly. And in some situations, it can cause death. You quickly wrap baby with a blanket. As you make your way to the hospital, please and please, it's important that when you've done all that have been mentioned in this video, you get the baby to the hospital to be properly assessed by the experts. The reason why the first aid is important when it comes to burns in babies is because the action you take within the first 3 hours of burns can either increase their chances at survival or can worsen their condition. Now, how do you make their condition worse? Number one, when you begin to apply unhealthy substance to the burn site. For example, you apply pap. They say raw pap. Please and please do not apply raw pap. The reason is simple. The burns area is a sterile burns. Your pap is not sterile. The raw pap is not sterile. The reason why you don't come down with infection when you take pap is because during the process where you are preparing it, it is exposed to hot water. So any microorganism in that raw pap is destroyed before you eat the prepared pap. But in this situation, when you use raw pap, you will be exposing that sterile site directly to microorganisms. Okay, so please do not use raw pap. Do not use raw egg. Do not pour an already exposed milk to it because the milk might have been contaminated. Another thing that is highly discouraged is the use of GV. It's a blue-like substance that people use when they are treating burns at home, and it is highly discouraged. The reason is because it alters the color of the skin, and so it will not give a true picture of the extent of the damage of the burns to that part of the body. So please, the only thing you do is either you put the part in cool running water for 20 minutes or you use a clean, wet, cool cloth and place over the area for 20 minutes as you make your way to the hospital. With this, you will help increase the chances of survival of the baby, and also help reduce the complication from the burns. I hope this helps someone out there. Share this video so that together we can help save many lives.